Vitamin B12 deficiency is a serious medical problem that affects an estimated 48 million Americans. If left untreated, this condition can cause irreversible damage to nerve cells. Most people, even those who are at highest risk like the elderly, aren't aware of the detrimental effects that a deficiency in vitamin B12 can have on their overall health. Dr. Ralph Green, MD, PhD, is here with what you need to know about B12 deficiency, as well as Dr. Peter Shaw, Chief Medical Officer of Emisphere. Good morning to you both. Great to have you on the show.
Good morning.
So great to have you on the show this morning. Let's start first with B12. It's a medical deficiency, right?
Well, vitamin B12 is very important. It is an essential nutrient. As you mentioned, Stephanie, it's very important for normal nervous system function. It is a vitamin that normally we obtain from certain foods that we ingest. But as we age, we tend to lose the ability to absorb the B12 because of shrinkage of the lining of the stomach. And in some individuals, even at a younger age, if there are diseases of the gastrointestinal system, then there's an inability to absorb normal dietary B12. And that leads to the deficiency of this vitamin, which will create a medical problem in the nervous system. This may manifest itself in the form of numbness or tingling in the hands and feet. It may manifest itself in terms of difficulties with focusing and attention span and memory, and in severe cases can actually lead to dementia. Now, of course, there are many causes of all these things, but vitamin B12 deficiency is something that is preventable, and it is something that can be arrested once it has been identified, for which testing is necessary.
So who is most at risk for this vitamin B12 deficiency?
Most at risk are older folks, individuals who are getting on into their 60s and beyond, but also among younger segments of the population if they have problems in their gastrointestinal tract, in the stomach and in the small intestine. Individuals with diseases like celiac disease and Crohn's disease, these individuals are more susceptible to B12 deficiency.
And now I understand that there are some new technologies that are emerging to help treat B12 deficiency without the need to get an injection. Is that correct?
Yes, that's correct. There are about 5 million Americans who require monthly injections of B12 because of the inability to absorb B12 taken by mouth in their diet or through supplements. Now, with new technology developed by Emisphere, there is a tablet that it's absorbed through a different route, and irrespective of whether people have got the gastrointestinal problems that Dr. Green mentioned, they are able to absorb B12 through the stomach and achieve levels equivalent to what they would get from a monthly injection by just taking a small tablet once a day.
Now, we talked about the elderly being most at risk, but that doesn't necessarily mean everybody else is immune to this, right? So we all kind of need to look out and maybe ask our doctors to check more frequently for this deficiency, maybe. Wouldn't hurt for everybody.
Certainly, if any of us are experiencing some of the problems that I've described, then discuss it with your physician. Ask whether it might be due to an underlying B12 deficiency. And if you are in that older age group, senior citizen category, then ask your physician whether or not it would be appropriate to have your B12 levels checked.
Now, is there a place maybe online where we can go to learn more about this B12 deficiency and even the new technology that you talked about today?
Yes, certainly. There are a number of websites. One in particular, knowyourb12.com, will give information to patients about the causes of B12 deficiency and also the new treatment available. And there's a very good government website, nih.gov, where they can also get information about all the treatments available for B12 deficiency.
Dr. Shaw, Dr. Green, thank you both so much for being here and sharing all these resources with us. We sure appreciate it. We're going to have more about this segment posted to our website. That's going to be at box4morningblend.com.
All right, are you a neat freak? If not, you might turn into one after this next story. Up next, how Modern Family's Jesse Tyler Ferguson is giving you a swift look on the allergens that live in your home. Stay with us.